Não queres vir, jovem? Anda, João! We can
No, it's
take
okay.
that thing.
Yeah, relax,
Okay.
it's fine.
Okay.
Could you begin to tell me what you're doing here?
So the van is for drug consumption. It's for people who use drugs, but it's more for people who inject drugs. We can inject drugs here in our van. We have a lot of paraphernalia of injected consumption, syringes, spoons, a lot of materials that we give to the people that come to.
Other than the drugs themselves?
Sorry?
Not the drugs themselves?
No, the drugs, no.
Is it just for injecting, or do you also facilitate smoking of certain drugs?
Here, no. We gave material for smoking too, but here it's just injecting. Yeah. It's
Okay.
just for people who inject.
Okay.
More than this, we have psychosocial appointments, health appointments here with nurses, doctors. We have another peer workers, people who use drugs, our clients, and they do a job with us. It's cleaning some places, give material to other users, and we have that kind of job too. Yeah.
Could you describe your profession, your experience?
Okay, so I usually work in a harm reduction center. Now I'm in the van. It's very great to see other people happy and have a place, a safe place, a hygienic place to do the injection consumption, free of HIV, free of hepatitis C. So it's very great to see that.
And were you working in a hospital before working here, or did you come straight from college?
Before I work here, I work in Moraria in a harm reduction center where we gave material. It's a drop-in. We gave material and have health appointments. And right now I'm in the van.
And you're a trained nurse?
I'm a trained nurse, yeah.
In college or university, did you learn anything about harm reduction?
No,
nothing.
Anything.
How did you come about this?
I was in a treatment station in Restelo, and it was the first experience that I have in that kind of drug use. Né? But in harm reduction, zero, completely. In the course, zero, yeah.
So this is kind of a peer-to-peer education?
Yeah.
And do you work alongside other nurses and medical professionals?
Yes.
Do you train anybody up? You do?
Now I train other nurses in other places, like in the first mobile consumption room, not mobile, the first consumption room in Lisbon, in the fixed,
the permanent one, yeah.
Yes.
This one just opened recently, right?
Yeah, opened recently.
So you actually
May,
provide training there.
Yeah.
Oh, brilliant.
We give training to the nurses that are now. Yeah. It's very great.
So you kind of work together now,
Yeah.
the mobile and the you're not the same organization.
We are not the same organization, but we gave. We have experience in that kind of job, so we gave them advices, of course. Yeah.
Brilliant. And have you experienced an overdose in your time here?
Yes.
How many were fatal?
None of
Never.
them. Never.
There's never been a fatal overdose.
fatal overdoses.
Wow.
But we have, I think, in the last year 4 overdoses, and in this year I think 4 or 5. But now we are in June, so it's a lot more than in the past year.
So you're also trained with Naloxone to administer Naloxone.
Yes,
okay.
Yes.
Was this from part of the program from the beginning?
Sorry?
Naloxone was part of your program from the beginning?
Yes, from the beginning. Yeah.
And Naloxone
now we have the Naloxone for people who use drugs, and we have a community program that we give to the users the Naloxone.
Okay.
We are the first team to do that.
Wow.
We give training to the users, and we give them Naloxone to use in their situations, in open spaces when they saw an overdose. Use it.
And where do you normally bring the van? How do you know where to go?
Okay,
What's
we
an
have
average
4
day?
stations. One here in Arroios, 2 in Arieiro, and another in Beato. It's the 4 stations that we have right now.
And how do you divide your time in a week?
So we start at 11 a.m. and at 7 p.m. It's the last. It's when we go home. In this we have 4 stations every day. It's Monday to. How do you say domingo?
Sunday?
Sunday.
Friday? 7 days.
7 days a week.
7 days a week.
7 days a
Okay.
week. Yeah.
Well,
Yeah.
are you a big team? How do you
We are not a
divide your
big
time?
team. No. We have right now. We are 7 people, I guess. Yeah,
And
we are
you're
not a
funded,
big team.
You're funded by the municipality here in Lisbon?
Yes, from the municipality of Lisbon. Yeah.
That's great. And
yeah.
your interactions with police, it's all positive? They
It's
know
all positive. Yeah. We have a community work, and they help us to when they saw people in the streets consumption, they bring the people to us. Yeah.
So there's no fear of arrest for your clients
no.
ever?
Ever.
Do you think a mobile unit like this could work in a country without decriminalisation?
I think it's hard. It's hard.
Your life is easier since
Yeah.
the policy with the policy
Of
change.
course,
Yeah.
Completely. Yeah.
Well, I'm trying to think. Well, okay. Any arguments like against a mobile drug unit?
Okay.
Do you have any experience with locals? Would locals ever come and be against this?
Locals come to our van, and we gave them information about what we do, and they are okay with us, I think. Yeah. In the beginning, I think it was a little bit more difficult, but right now they have the curiosity to know what the work we are doing in the van, and when we show them that, I think it's really great too.
It's nice to demonstrate by showing them as well.
Demonstrate by showing. Completely. Yeah.
Do you think supplying heroin through like a heroin assisted therapy might be something to look forward to, or
yes, of course.
you think so?
Yeah, completely. Yeah. So we have Kosmicare. They are a drug checking team, but our people don't know what are
You don't know
consuming.
really.
So
Yeah.
it's really great to know what they are consuming, and if we can give them that, it's really great. I think it's the next step in our van in Portugal in general.
So I was just talking to Kosmicare, and they mentioned that the discarded syringes can actually be tested.
Yeah.
So the user doesn't need to give up the drug. Actually.
Yes, and we have a partnership in that.
Yeah.
Where they test our drugs, the drugs that people can.
Do you have any information to reveal currently about what kind of substances you've collected so far?
Okay. Yes, but
It's a conversation with Kosmicare.
It's better with Kosmicare, because
Okay.
I'm not an expert in that area and I can give you wrong information.
Well,
Sorry.
Brilliant. Thanks, Joanna. I really
Nada,
appreciate talking to you.
thank you.
It's great. I really love
Thank
what you
you,
do,
thank
and
you. Obrigada.
it's inspiring work. Thank you.
Thank
really.
you. Really, thank you.
Yeah, this is
You are
really
amazing.
good.
You are a great guy. Thank you.